Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a March 4th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 new case trend line is trending downward with 219 cases reported in the last 14 days, which is a slight decrease from the 14-day period I reported last week. Iowa has detected 14 B117 variant strains through sampling at the State Hygienic Lab, and that's 4 more than last week. And nationally, 51 states report a total of 2,506 B117 cases, and that number is almost double the number I reported last week. You're going to get sick of me talking about these variances, but I'm telling you, we have to take them seriously. They could be the cause of the next surge in COVID-19 cases. Taking them seriously means not just looking at the downward trend line in cases we're having here in Dubuque County, but thinking of how travel and letting your guard down by not masking up and keeping your distance from others will keep these variants at bay. At least 60% of our population is at risk for getting infected with the virus, which leads into how are we doing with vaccinations? Dubuque is getting all of our vaccines administered within the week we receive them, thanks to our healthcare partners and pharmacies. About 8,600 Dubuque County residents have received their second dose and completed their vaccines, while another 10,700 have received their first dose. And we continue to focus on those 65 years and older, primarily because that age group has by far the highest number of hospitalizations and deaths, meaning they get the sickest. This week we received some Johnson & Johnson vaccine, which will be targeted toward manufacturing and distribution workers who can't social distance while they work. This is another large group, and we're still gathering the numbers on how many, but there will be thousands. Now that there's another vaccine available, the Johnson & Johnson, which only requires 1 dose, you may be thinking, which vaccine is best? Or which one do I want to get? Don't put a lot of thought into this, because while vaccines continue to be in short supply, you won't have a choice. And if you want a choice, you will have to wait until there are no supply issues of any of the vaccines, and that's going to take months. Why shouldn't you be concerned about which vaccine to get? Because they're all highly effective. The Pfizer and Moderna vaccines have a 94 and 95% efficacy rate. This is rare in vaccine effectiveness. Our yearly influenza vaccine is anywhere from 60 to 70% effective, and sometimes lower. So the bar has been set really high. The Johnson & Johnson vaccine has a lower percentage efficacy, but it, more importantly, keeps people from severe illness, being hospitalized, or dying from COVID-19. Efficacy is a statistician's term, and there's a lot more to it than just the percentage. So bottom line, take whatever COVID-19 vaccine is offered to you. And my thought is, you get what you get and you don't mind a bit. Throw in, you're also grateful. For those 65 years old and older, some pharmacies right now, Mercy One and Hy-Vee, are offering vaccines. Sign up is through their websites. If you can't sign up online, the best thing right now is to ask a friend or family member who has online access to help you. More pharmacies will be getting vaccines directly from federal allocations, but I don't really know how soon, so please be patient. As we start out March with hopes of spring, it is well on my mind that we've been in a pandemic for a solid year now. We've come a long ways, and with a lot of effort, many have not been infected. Many have recovered, and sadly, some have passed away or are living with long-term effects from COVID-19. Please continue to mask up and keep your distance, wash your hands, and you can now be with others more in the outdoors with the warmer temperatures. That's a huge positive. Have a great weekend, everyone. We're still in this together, and remember, life is fragile, life is a gift, so do the right thing.